Looking at the questions from this section, a female presents with pain and swelling over multiple peripheral joints. Deformity shown below. You can see the swan neck deformity. What's your diagnosis? RA. Universal hand images are coming and RA is the answer. Involvement of PIP, DIP, first carpometacarpal joint, sparing of the wrist in MCP, osteoarthritis. Remember OA, RA. That's what we did. Arthropathy's theme and focus. So they will give you multiple conditions and then they'll give you case scenarios to choose between the two. Ankylosing spondylitis, remember low backache, young man. Rheumatoid arthritis, peripheral joint involvement. Gout, recurrent infusions in the lower limb, more in the great toe, sometime in the knee joint. Pseudogout, knee involvement with chondrocalcinosis. Psoriasis, there will be involvement of the hands. Reactive arthritis can be associated with spondyloarthropathies. First case, 60-year-old man, inflammatory backache, difficulty in sitting and standing, shows a fixed SI joint, ankylosing spondylitis, sacroiliitis is there. Case 2, middle-aged male, acute onset right knee fusion. Such episodes are recurrent, gout. Recurrent effusions is gout. A patient presents with a knee joint pain, aspirate of the synovial fluid, WBCs are high, viscosity unchanged, no other inflammatory marker, swelling around the knee joint is present. Which of the following is a possibility? Most of the diseases which have inflammation and will reduce the viscosity, except osteoarthritis, which is absolutely non-inflammatory and maintains the viscosity. Osteoarthritis, joint pain, because of the stretching of the synovial fluid, synovial capsule, cartilage destruction. There will be osteophyte bone formation. Inflammation can occur in the late stages, but it's classically a non-inflammatory disease. And subchondral bone formation is also a rare answer. So A, B, and D are the answers. More specific for diagnosis, although more than 90% cases are associated with HLA-B27, but essential criteria is radiographic sacroiliitis for ankylosing spondylitis. A patient has RA, what's the treatment? So you'll give disease-modifying drugs with short course of steroids to the start. The first answer can't be correct because you are not giving the specific disease-modifying drugs here. Question number 8. 10-year-old presents with ankle pain, lytic lesion with sclerotic rim, histopath is shown. This is the classic hemophilia. Patellar lung syndrome, femoral component during extension. True about reactive arthritis is triad of arthritis, urethritis, and conjunctivitis. Hyperkeratoid lesions on palms and sword, called as keratoderma blenneragicum, related to infections by chlamydia and shigella. Anti-uveitis is seen. Spine involvement is very common, so this is wrong. About OA, choose the correct statement. Thickening of synovium is one of the earliest features. This is of RA, so this can't be the answer. Weight bearing is a common etiology, true. In India, knee OA is very common, true. In fact, we have good hips and bad knees. So our knee OA is very common. Hip arthrodesis if done can decrease the pain, but will cause a decrease in joint movement. Absolutely true. MC is commonly not, in fact, is paired. So this is also not possible. This is also not possible. A person has an injury on the dorsal surface of PIP. Which of the following can occur? So there can be a rupture of lateral ligament. True. There can be buttonhole deformity. True. Mallet finger is not a possibility because it will occur to DIP. Swan neck is not a possibility because this will occur due to flexor defect. And laceration of central slip of extensor, correct. So answer is ABD. Question number 13. Which of the following is not true regarding inflammatory arthritis? Presence of morning stiffness is seen. Sclerosis, not seen. There is osteopenia, so that is not seen. Martel sign and seen in which of the following condition? Gout. Overhanging bone edge around the first metatarsalpharyngeal joint. 40-year-old female presents with urine darkening or standing with pigment deposition in the bone. This is alkaptonuria, classical. Alkaptonuria, sometimes we operate a knee and we see the black fluid. X-ray features in hemophilia, widening of the notch, osteopenia, squaring of the patella, osteoporosis, bone cyst formation. All are correct. This is inflamed first MTP, grade 2 gout. 62-year-old male complains of pain on bilateral knee, right more than left. He has difficulty in climbing stairs, squatting and sitting cross-legged. These are three movements which are affected when the knee joint is affected. He can't perform the activities of daily living. On X-ray, there is a subchondral sclerosis, decreased joint space. So, what is the treatment? You will go for a knee replacement because more than equal to 60, limitation of activities of daily living, there is involvement of the joint surface causing osteoarthritis, replace it. Patient develops breathlessness and chest pain. On the second post-operative day after a hip replacement, right-sided changes in the heart are seen. What's your diagnosis? Pulmonary embolism. 36-year-old female complains of morning stiffness, first point. Swelling of the multiple joints of hands, more than 3 joints. Bilateral involvement, symmetrical involvement. RA factor is negative. Anti-CCP is negative. ESR and CRP is high. This is classical RA. Now, in spite of RA factor and DCP being negative, if we look at the modified New York criteria, that's for ankylosing spondylitis. 1987 criteria, classical criteria for RA. 2010 criteria, new criteria for RA. When we look at 2010 and 1987 criteria, in 2010 criteria, more than 10 joints involved 5 points, plus ESR CRP high 6.6 out of 10 RA. In 1987 criteria, there is morning stiffness, plus hand involvement, bilateral involvement, and there is more than 3 joints involved. 4 out of 7 is involved, so this is RA. By both the criteria, in spite of RA factor and being negative, the answer is rheumatoid arthritis. A 65-year-old man complains of back pain for 3 months. ESR is high. He has a dorsal lumbar tenderness, mild restriction of chest movements. There is tenderness of the vertebra. Diagnosis, ankylosing hyperostosis. Whereas a young patient with reduced chest expansion, with involvement of low back ache, answer is ankylosing spondylitis. The given X-ray can be seen in, this is classical of Forrester's disease or DISH. So this is about the joint disorders. Remember, hand, multiple joint pains, morning stiffness RA, low back ache, young man, reduced chest expansion, ankylosing spondylitis. Thank you.